And articulations are the connection between the two bones. These connections may be for different reasons. One, it could be for a stabilization of the joints, or it could be for the mobility. So based on that, there's two different classifications. One of the classification is based on the function or mobility, and under that you have three different types of joints. One is called Synarthroses. It means these joints are not mobile. The second one is called Amphiarthroses, that they are slightly mobile. And the third one is called Diarthroses, that they can move freely. The second classification is based on structure or histological features. So some of them are called fibrous joints, so they have collagenous fibers. The second one is the cartilaginous joints, and that is related to cartilage, so it can be hyaline cartilage or fibrocartilage. And the third one is called synovial joints, and these are very mobile joints, and they are made of hyaline cartilage. They may have fibrocartilage, but mainly this hyaline cartilage. So this classification of the joints are very important to know. So the first one is called Synarthrosis. This is a functional classification. It means they are not movable. Based on the histological features, they are subdivided into fibrous, cartilaginous, and bony. So the fibrous again divides into two parts. One is suture and the other one is gomphosis. Suture is between the bones in the skull. So these are the flat bones, and these connections that you see, these are called sutures. So this is a type of joints, and they are like a sawtooth. They interlock with each other, and they are connected with each other by a dense and regular connective tissue. So this joint is not the same as sutural bones that we talked about it in the classification of the bones. It just means the sutural bones are located in the sutures, and suture itself is a joint. It's a non-mobile joint. So Gomphosis is located in the jaws. So this is the teeth, and this is the teeth as a tooth socket. So these teeth are inserted in the upper or lower jaws and the maxilla or mandible through these ligaments. These are the ligaments, and these are called the Gomphosis. So this is dense regular connective tissue. There's other structures in the teeth that support this connection. It's not just these ligaments, but if there is infection grows around this area, then it can destroy these ligaments. So this is what you can see in periodontitis. The tooth can fall. Also, if there is any osteoporosis forms here, so the bone become weaker. So then also this connection is lost and the tooth can fall. The second type of Synarthrosis called cartilaginous. These type of joints, these are called Synchondrosis. It means that they are made of cartilage, but the cartilage is not mobile. One example is that epiphyseal growth plate, which is located between the epiphysis and the aphysis of the long bone, and this is the area that the bones grow, but they are not mobile. And the second one is this area between the first rib and also the sternum. This is manubrium of sternum, and this cartilage is not mobile. These other cartilages are mobile, but this one is not the mobile one. The third type of Synarthrosis is called Synostosis. This is made of connection between the two bones. So one example is in the frontal bone, that initially when a baby is born, the frontal bone is a little bit separated. There's two of them on each side, one on each side, but then they fuse together, and they are immobile, so they cannot move. Another example can be in the mandible and the lower jaw. So again, when a baby is born, there's a little bit separation, and then they fuse together, and they will not have any kind of mobility. So there's the different type of connection that can happen between different bones. The third example is epiphyseal growth plate, which was this one. So this one can later on fuse, so ossify this area, and once it's ossified, then it changes from cartilaginous to the bony, from Synchondrosis to Synostosis. So this happens after the puberty. When the growth stops, then that change will happen. So the second type of joints based on the mobility is called Amphiarthrosis. So there is some mobility here, not a lot. They are divided into fibrous and cartilaginous. Example of the fibrous is called Syndesmosis. It means that these are made of dense regular connective tissue, and you see it between the tibia and fibula and the lower extremity, or between radius and ulna in the upper extremity. The second type of amphiarthrosis is called Symphysis. This is made of fibrocartilage, and a good example is between the two pubic bones here. This is the pubic symphysis between the two pubic bones, so connecting these two bones together. But in the later part of the pregnancy, near the labor, this joint becomes softer, and during labor it can actually stretch a little bit, so that the fetus can pass through birth canal. Another example of the symphysis can be in the intervertebral discs, so between the bodies of the vertebrae, and that gives mobility to the vertebral column, but also keep the vertebral column together. So it keeps it strong, but also gives it some flexibility at the same time. The third type of joint based on mobility, this is called Diarthroses, and there is a lot of movements in these kind of joints. These are called Synovial joints, and these are made of the cartilages, mainly hyaline cartilage. So one at the end of each bone, and they are connected with each other, and this is a capsule that wraps around that area.